What are you most afraid of when it comes to dermal fillers?
So the most common reply is migration.
That's an idea of what migration is. What migration is not, however, is...
If you just place filler in that cheek area willy-nilly, then you're going to get problems down the line.
It increases the risk of filler just squirting out in a different direction.
And a year later, small bumps on her eyelid here.
The filler needs to be able to withstand twisting forces, tension forces.
So when I felt that area around her jawline, it actually felt like rubbery filler. And then here you can see her 2 weeks later. That's with no filler, actually filler dissolving.
What if, you're in the 1% of unlucky patients where Hi everyone, my name's Dr. Sanjay Trikha and this is Dr. Zoya Diwan. Together we are doctors at Trikwan Aesthetics and today we're going to be talking about the subject, what are you most afraid of when it comes to dermal fillers?
So we ran a poll on our social media and we got so many responses. I was actually quite shocked because there's a big barrier to people actually getting fillers done, and we had lots of responses, and we thought actually rather than making one YouTube video, there were so many different things that people wanted to talk about. We're actually going to create a 4-part series on YouTube discussing the most common reasons why people are afraid of getting dermal fillers. So the most common reply that we got was migration, which was actually quite surprising for us. So what we're going to do is make the first video of the series about migration only. The second part is going to be on looking unnatural, puffy, overdone, which is a huge concern of lots of people. And then we're going to talk about the thing that people are quite often afraid of as well, which is blindness and vascular occlusion. That's going to be part 3. And then part 4 is going to be all the extras like infection, lumps, bumps, all these things. And we're going to talk to you about why these things occur and whether or not you should actually be afraid of these things or not, and what we do as a clinic and as doctors and as healthcare professionals to prevent all of that.
So part 1 of the series, what are you most afraid of when it comes to dermal fillers? Now today's episode we're going to be focusing primarily on migration. So when we talk about migration, I think the most common things that come to mind are going to be, imagine a lip filler treatment and imagine kind of the fillers spilling outside of the lip, the ridges above and beyond the lip, volume kind of appearing around the mouth more so than within the actual lip itself, and looking very unnatural and obvious, like something's happened that maybe shouldn't have happened or maybe wasn't intended. That's an idea of what migration is. What migration is not, however, is, let's imagine if we treat someone in the nose and then the filler appears in their forehead, or we treat someone in the cheek and suddenly it's going to be, in their chin. That shouldn't really be how we think of migration. But to learn,
because that does not happen.
No, that does not happen. But to learn a little bit more about migration, tell us a little bit about it.
Yeah, so the first things to consider are that there's a number of different types of dermal fillers. So now, most commonly, the dermal fillers that are used or should be used really are hyaluronic acid-based dermal fillers, because this is what we have naturally in our own bodies and the body responds to it the best. There are other types of more semi-permanent dermal fillers like silicone, calcium hydroxyapatite, and lots of other different sort of technical names for them, but they're all semi-permanent and they're not made up of hyaluronic acid. They're made up of something completely different that can't actually be dissolved, and they last a bit longer in the body, and they're a little bit more traditional and old school. So in the literature and in terms of research, the most common type of dermal filler to cause migration is actually silicone, and that was used a lot back in the day. In the 80s, 90s, it was all the rage, and some people still use it now, but it's the one that causes the most migration. When you look into the research and the literature, there are a few case studies looking at migration with hyaluronic acid-based dermal fillers, and I'm going to talk to you about one such study. So this was back in 2015. There was a lady who had dermal filler treatment with hyaluronic acid just on the side of her brow over here. I'll show you on Sanjay, just over here. And she had hyaluronic acid placed there, and a year later she noticed small sort of nodules, bumps on her eyelid here. I'll show you on Sanjay, on his eyelids here. So what does that mean? What happened? what they did at the time, the practitioner she went to see 1 year later, he actually took a biopsy of the lumps, and they found under microscopic examination and staining that it was in fact hyaluronic acid, but also inflamed tissue. So this is what we call the delayed onset nodule. Some types of hyaluronic acid fillers, so some brands, are more prone to becoming inflamed and to migrate. So this is what happened with this lady. It was removed and everything was completely fine, but this is a case study that showcases the realities of potential migration with hyaluronic acid dermal filler.
Just to, I guess, summarize that almost, it's like saying when we're talking about these injectable treatments, on the one hand, you've got things that are going to be more high risk to migration, like semi-permanent stuff like the silicone, but then within the realm of hyaluronic acid, there's going to be different types or qualities of hyaluronic acid, some of which are more likely to migrate and some of which are less likely to migrate.
Yeah, and we're going to talk you through in detail now about all the different potential causes of migration and how to avoid them.
So there are 7 main causes of migration, the first of which is going to be technique. So when we talk about technique, are we using a needle or are we using a cannula? Is it applicable to the right plane of tissue that we're in? Are we using the right type of angle when we enter where we're trying to treat? All of these are different factors that need to be considered, because if the technique is incorrect, that can lead to a more likely case of migration. With regards to things like technique, it's very difficult for patients because in our field, everyone goes about these things slightly differently, and aesthetic medicine is a growing field all the time. So there are lots of doctors, ourselves included, who are heavily involved in research and publications who are trying to globally publish the best ways to go about doing certain treatments. And the good thing about that is things are always getting better and better and better.
For example, with techniques, and we were talking about lips before, when you consider the lip area, some people very traditionally will inject boluses, which is like small balls of filler into different parts of the lip, and that's actually going to create bumpy lips for sure, but also when you inject large quantities into one small area, that's more likely to push the filler, which we're going to talk about as well. But it all starts with the technique. The other thing that people do is something called vectoring, where you go in with the needle from the top of the lip and then move all the way down and then pull out the filler. So that technique can be done, if it's done correctly, it can be quite good, but a lot of people will start just outside the lip. So when the needle's coming out, you'll get residual drops of filler just sticking to the outside of the lip. So again, people aren't using the correct techniques to apply the filler, and therefore you can get what looks like migration or things that can increase the chance of migration as well.
So after technique, the second thing that we're going to consider is going to be specific and individual anatomy.
Yeah, so there's an image on the screen now, just looking at, for example, the different fat pads of the face. So we've got lots and lots of stuff going on in our face. A lot of our patients will always hear, our spiel that we give you all about the different layers of the face and how everything ages. But this image in particular, I thought I'd put up because it just showcases this area of the face. And it's showing you the very, very deep fat pads that we have that are quite adherent and stuck to the bone in this middle cheek area and just below the eye. When we're injecting or restoring volume in this area with dermal fillers, we're being very specific and very precise in trying to get a certain volume of filler into these different areas. And actually there's papers and publications about exactly how much you should put in each of these locations to get the best results for patients. It's not about, oh, there's 3 fat pads here, let me just put equal amounts in all of them. Actually, different ones will give you a different type of response with the tissue and with the filler. So you've got to be very, very precise in where you're placing it, why you're placing it there, and also how much you're placing in these different areas. So obviously we're talking about more than just anatomy here, but the anatomy is where it starts from. You've got to understand it. And this is just a very small area of the face here. I mean, people get injections all over the face. The lip is different, the nose is different, other areas of the cheeks, jawline, temples, it's all very, very different in terms of the anatomy. This is just to show you a very simple example of what we're working with. And as you can see in these different fat pads, they're compartments. So when you place the filler in them, it's very difficult for it to leave that compartment if it's placed in the correct location, because they are surrounded by things that will stop that from happening. But if you just place filler in that cheek area willy-nilly wherever you like, wherever you think that you want to place it, then you're going to get problems down the line. Immediately it might look good, but of course that filler is going to move because there's nothing holding it in place.
Number 3 is going to be too much dermal filler for the area. So this ties into technique, and it also ties into anatomy as well, because there are certain areas where the filler is going to make a huge difference using very little.
Yeah.
Likewise, there are certain areas where you need to actually use a higher quantity to try and achieve what you want to achieve. So getting the correct amount is essential to make sure that we've got a reduced risk of migration.
And there's like research papers and literature on exactly this and how much you should be placing in different locations, using cadaveric dissections and studies, and just placing however much you think willy-nilly is just not going to cut it.
So the 4th one is going to be injecting under too much pressure. Now, with injecting, the best techniques are going to involve really, really slow, gentle injecting pressure. When we do that, it lets us be a little bit more specific about where exactly we're injecting. It makes it less painful for the patient because there's less immediate stretching of any tissue or anything like that. A lot of injections can be relatively painless or altogether painless, really, depending on the technique that's used. When we do inject with too much pressure in certain areas, it increases the risk of filler almost just squirting out in a different direction, or going not exactly where we want it to go, or going somewhere a little bit either side of where we want it to go. So to be really, really specific, we inject really, really gently.
Number 5 is over massaging the treated area. So for example, if you get treatment in your lip, some practitioners will really, really, really massage a lot. And actually this goes back to a few of the other points that we made about technique. If they're, injecting with boluses or those balls in your lip, then when they go to massage, they're going to feel those, so they're really going to go for it. And actually that can really push the soft filler that you put in the lip into other compartments, which shouldn't happen. One of the areas that we see this quite a lot in is people will inject the tear trough region, so that's this area here under the eye, the groove under there, and where you're meant to place the filler there is very deep onto the bone, because that's where the ligament or the tear trough ligament is attached to. A lot of people will try and put the filler quite superficial, because when you do that, immediately it looks really good and you only need to use a small amount. But actually there's nothing holding that in place, it's just skin. We don't actually even have much fat in this area, if at all. So people will put filler superficially, so they're using the wrong technique. But then what they'll also do is do really rigorous massage. So they'll really squish and squash the filler around here. And because there's no ligament or anything, any attachment keeping it in place in the location that it should be, it will spread around here. And that's when you can see it on people where they've got a bit of a sausage shape there, or it just looks very obvious and looks like it's been done. So there I'm talking about 2 different things, so technique and overzealous massage. So it's really important that you don't massage a lot. And it actually goes down to product selection there too. So a lot of people will use products that are very thick or poor quality fillers that are cheap, and they require a lot more massage because they're a lot harder and stiffer. You need to use something that's soft, gentle, molds with your face, moves with your face. We've got lots of videos about, talking specifically about filler choice. So the next point number 6, is lymphatic spread. So that sounds quite complicated, but essentially what that's saying is we've got lots of lymphatic system. We've got a lymphatic system in our face, which drains fluid, drains generally the waste in your face. And it's in certain locations around the face. And if you get filler into it, even small droplets, it can block off the supply or block off the drainage. One of the areas that we see this quite often is around the eye, where people go too superficially around this area of the eye, and that can cause a little bit of puffiness and swelling around this area. So that's filler not being in the right place and migrating and blocking off those vessels.
So finally, with number 7, we've got what are termed vascular events. Now, these are going to have their own video later in the series anyway.
Yeah, part 3.
Part 3. But the way that that relates to migration is essentially if filler is in a blood vessel, it can travel within that blood vessel and go somewhere where we don't want it to go. So again, all the previous considerations are part of this when you're talking about the right technique, when you're talking about understanding the anatomy, the right product choice. All of these are different factors to help avoid vascular events. So
we're going to talk you through a couple of examples of filler migration that can happen if these 7 things that we haven't discussed, even if one of them isn't respected properly. So the first example that I'm going to talk about is the jawline. This is a really important example. Actually, both of them are it's not just what fillers look like on the day of the treatment. When you see a good before and after, is almost always the day of the treatment. You need to make sure that that filler looks good at 2 weeks, 2 months, 6 months, 1 year. Migration can take time to happen. So you need to make sure that the treatment that you get done and with whom you get it done understands these 7 principles that we spoke about.
So if you think about just the anatomy, for example, the filler needs to be able to withstand twisting forces, tension forces, pushing and pulling that goes on.
Yeah, like talking, laughing, smiling.
Every minute of every day within your face. So of course, quality of product, where it is, ensuring all these small little things are correct is absolutely essential to make sure the treatment looks good long term.
Yeah, it's your face. Right, so first example is of a lady who had her jawline treated. So here you can see an example of the snatched jawline, or the viral trends that go around, and this is an immediate after of a treatment that some people might think is aesthetically pleasing. And it was quite a viral trend. It was all the rage for a while, but obviously people have calmed down now, which is good. But to achieve this, what we were noticing was that people were placing filler along the jawline in incorrect places. So when we look at the jawline, there are a few different ligaments in the face. So I'm just going to show you a drawing here of where the ligaments are. So as you can see, there's one just in front of this thick muscle that you have here, and then there's one just by the corner of your mouth. But in between, there's actually no ligament. So this area here, Sanjay, I don't know if you want to point out on my face where that area is. So like here is where your jowl sits. And actually, if you place filler along here, there's nothing but a very thin septum that is holding it up. So if you place a thick, hard, high quantity, high volume of filler in this area, eventually it's going to start migrating down, and it will actually add to jowling and make your filler here just migrate and go downwards. So this is a patient. You can see her photos. She came to me concerned that 3-4 months ago she had filler placed along her jawline, and since then, over the last few months, she's noticed that she's getting heavier lower face and more jowling. So when I felt that area around her jawline in this jowl region, it didn't feel quite like fat. It actually felt like rubbery filler material, quite hard. So what we did was we dissolved this region, and then here you can see her 2 weeks later, and that's with no filler, actually filler dissolving. So we dissolved it, and you can see that her jawline snapped right back if you want. And then this is a few weeks later of the patient. These are her own photos as well.
But in that example, when you talk about even feeling the filler later, the way that filler feels when it integrates with your tissue is determined by the quality of filler as well.
Yeah.
So even with high quality fillers, even with these types of things going on, it's something that integrates so seamlessly that it's quite difficult to feel.
Yeah, it should just feel like your own. And that leads us on quite nicely to the lip. Lip is a really important place where the filler should feel like it's just part of you. You shouldn't even really be able to feel it when you touch your mouth. It should just be soft, well integrated, looking really natural. So obviously there's been these viral trends of getting the Russian lips, or these huge lips, and you can see examples of them popping up over Sanjay's face maybe right now. And a lot of people were asking for this, and thank God that trend has died down now. And I think it's because here you can see what happens a few months later. So here you can see migration around the lip, but there's lots of other things that happen with the technique that is used to create these lips and the thickness of product that is used. So people use very high thickness product to create these lips. They also use techniques that encourage filler to be placed around the lip line as opposed to within the lip line, and they put very high volumes in to create this as well. So you've got a lot of things going on. So 3-4 out of those 7 that we spoke about are not being respected when you're doing this treatment. So immediately it might look like all those images that flashed up, but a few months down the line, it's going to look like this, where you've got migration, lumps, asymmetry, so many things going on.
It comes down to respecting the anatomy as well, because it can be okay to want to lift your lip a little bit, or for there to be a subtle lift towards the side. It's a really common request. But there's only a certain amount that we can actually lift, because depending on your own anatomy, if you put too much in, you can create heaviness, it can collapse, it can spill out above the lip and cause migration. If it's done correctly, you can get a little bit of a lift, but limited by or determined by your natural anatomy. And that's something that should be discussed and assessed for you and with you at your consultation.
Yeah.
So in summary, we've discussed in quite a lot of detail a lot of different reasons why migration might be a factor to consider, and a lot of reasons why people should indeed fear migration. Having said that, I guess in our clinic our philosophy is we want to try and control as many of these factors as possible with every single patient. So whenever we see anyone, we're going to have a full detailed consultation to discuss the type of treatment that you want to achieve and what's possible versus what's not. Then we're going to look at your actual anatomy to see what we can do and if it's suitable for your own anatomy. In terms of how it's done and quality of product, these are really, really carefully decided based on minimising the risk of any complication and maximising the chance of us getting a positive outcome. So with type of filler and quality of filler, within the UK there are about 200 brands of filler, which is a hell of a lot. And out of the 200, about 195 are terrible, which sounds alarming, but it's all to do with the evidence-based, the clinical trials, the research behind certain dermal filler brands compared to others.
Yeah.
So like everything in life, you're going to have really good quality ones and ones that are perhaps not as good quality, and those are the ones that are going to be far more likely to move around and migrate and not respond in a way that you would expect them to respond. So in terms of quality of product, we talk a lot about that. I always give a patient a sticker of exactly what they've had, because I want you to be able to look into and read and research exactly what we've used, because I almost do it as a point of pride. I feel like as a doctor you should be proud of what you use, and the patient should be able to look or request or see what has been used, and then when you read into the product, it should be a case where the more you read about it, the happier you get, because you should have that peace of mind that actually what I've used is really, really as good as it gets, and what I'm injecting into my face is really as good as it gets. So when we factor in your consultation, your anatomy, an appropriate treatment plan being done the right way, using the right quality filler and followed up appropriately, this entire process should be seamless, and migration really isn't something that any of our patients should have to worry about. Having said that, it's also worth bearing in mention that when you treat hundreds or indeed thousands of patients, there can be a little bit of scope for variation. Whenever you're doing a medical-based procedure, nothing is ever guaranteed. So everything we do is to try and minimize the risk of things going wrong. But having said that, what if you're in the 1% of unlucky patients where even when all of these factors are done properly, you could still be in a 1% of patients where there is a little bit of migration? In that situation, you need to make sure that the clinic that you're going to is someone or somewhere that's going to be very happy to manage that and look after that, because when you treat thousands of patients, if 1% go wrong, that's a very low number. So actually, for people who are unlucky enough to be in that position where potentially there might be a touch of migration, which is possible if extremely unlikely, you want to be somewhere where actually it's going to get looked after and it's going to get dealt with very quickly and swiftly and not in a stressful way.
So in conclusion, as you can see, all of these things that we've mentioned today, it's nothing that's on the patient. It's actually all to do with the practitioner and the clinic that you choose to go to. So, really do pick wisely, and, take your time and really consider where you'll go. Ask them about what products they use, ask them about their experience, ask them about their before and afters, ask them about their complications management protocols. Really do your research. So we hope you've enjoyed and really learned from part 1 of our 4-part series on what are you most afraid of when it comes to dermal fillers. We'll be back next week with part 2, which is all about looking unnatural, overdone, puffy in the face.
So if you've got any questions or you want any particular further information on any of this, please do leave us a comment and we will get back to you. Thank you.